There is a stark and almost disturbing contrast between the high-tech equipment used by these health workers and the rural African setting of those they have come to protect from the ravages of the rare but deadly Marburg virus.
Assalamualaikum and hi, my name is Syahrul Hisyam. My metric number is B0818101147.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Hamizah binti Baudin.
Assalamualaikum, my name is Nur Alia binti Zulkifli. Metric number B0881810470.
Assalamualaikum, my name is Nur Afifah binti Azman and my metric number is B0818102005.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Syahrul Hisyam. So my metric number is B0818100090.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Fizul Adin. My metric number is B0818100099.
Hi, I will present about introduction. So first, Marburg hemorrhagic fever is a severe and highly fatal disease caused by a virus from the same family as the one that caused Ebola hemorrhagic fever. Both diseases are rare but can cause dramatically outbreak with highly fatality. There is currently no specific treatment and vaccine. Second, the virus can be transmitted first by exposed to the one species of fruit bat, or second, it can be transmitted between the people via the body fluid through unprotected set of broken skin. Actual treatment of the virus after the infection is not possible, but early professional treatment of symptoms like dehydration considerably increase survival chance.
I will explain about history of Marburg fever disease. So this virus, it started in 1967 at Germany and Yugoslavia with 31 cases and 7 deaths. It started from the laboratory staff working with green monkeys African and become infected and passed the virus to the co-workers and their families. At 1975, in South Africa with 3 cases and 1 death, it caused from the Australian man died after traveling in Zimbabwe. Another 2 people are contracted from the virus. In 1980, at Kenya with 2 cases, 1 death, it started from the Frenchman that died after traveling to Kenya's Kitum Cave. His doctor that treated him is developed the symptoms. The virus continues to Kenya in 1987 with 1 case and 1 death. It caused from the teenager around 15 years old. He got sick and died after traveling to Kenya's Kitum Cave also. In 1998 till 2000 at Congo, virus sold out, means the virus increased to 144 cases, 154 cases and 128 deaths. And this outbreak originated among young male workers at a gold mine in Durban. It is spread to the nearby Watsa. The doctors found that infections by several different strains of the virus but never found the source where it started up. In 2004 till present, at Angola, virus increased with 264 cases and 244 deaths. The virus increased were only detected on March 21 of this year. The outbreak based in Uyghur province is believed to have begun in October 2004. So that's all from history of Marburg fever disease. Thank you.
Okay, now I will explain the description of the nature and issues involved in the epidemic, or what we can say is the outbreak case of this virus. Firstly, in 1967, in this year, Marburg virus disease was first identified when outbreaks in Germany and the former Yugoslavia were related to African green monkeys Cercopithecus pipius imported from an Entebbe, Uganda primate export factory. 7 deaths resulted in primary cases. Next, in February 1975, the first documented Marburg virus outbreak in Africa occurred in this year. A young Australian was the index case and he had been visiting Rhodesia. He was admitted to the Johannesburg hospital and died on the 7th day of his stay from a hemorrhage caused by a combination of hepatic failure and disseminated intravascular coagulation. Next, in 1980, 2 more cases were recorded in this year, one in Western Kenya and the other one in Uganda, not far from the source of the monkeys implicated in the 1967 outbreak. The second case involved in the patient's attending physician in Nairobi. Next, in 1987, a young man who had travelled widely in Kenya became ill and died, indicating the presence of yet another infection. And the next year, 1998, Marburg virus disease broke out in the Northeastern Democratic Republic of the Congo. Over December 2000, follow-up surveillance detected more than 150 incidents. And next, in 20 March 2005, the BBC News Service announced that at least 96 people had died in Angola in the previous 5 months as a result of an outbreak of a disease believed to be Marburg disease, which had symptoms similar to Ebola. According to the news service, Vice Health Minister Jos van Dunham said that 101 cases of the illness had been registered in a hospital in UAE, and 93 people had died and 2 people had left the hospital without being properly discharged.
In 23 March 2005, the World Health Organization WHO announced on that year that the Marburg virus was the cause of a viral hemorrhagic fever outbreak in Northern Angeles, Uyghur province. In 25 March 2005, the BBC announced that the virus had spread to Luanda, the capital, where a sick patient had been diagnosed, all of whom had recently visited each. In 6 April 2005, 156 people had died, and working conditions for healthcare workers were exceedingly difficult. By 8 April 2005, according to one report, the dramatic symptoms of Marburg virus disease and its recurrent fatality are resulting in a high degree of fear, which is exacerbated by a lack of public awareness about the disease. Whose spokesperson was quoted as saying, "In the same date, 8 April 2005, the World Health Organization WHO requested $2.5 million from the United Nations to help with the outbreak's emergency response. By 22 April 2005, a study was released claiming that the virus epidemic in Angola which had claimed 244 lives, had been contained to the province of H, with no new cases discovered outside of the northern region.
Okay, for application of ethical principle and theory that related to public health issue, I will explain to you about two ethical, which is utilitarian ethic and ritual ethic. So for utilitarian ethic, is a moral theory that focuses on the overall balance of positive and negative effect of healthcare professional actions. All the actions are considered on the basis of consequence, not on the basis of fundamental moral rules and principles or with regard to character traits. When this ethic used in public health issue, it will stipulate that whenever there is a choice between different but equally efficacious method, of treatments, patients' benefit should be maximized and the cost and risk will be minimized. Any other approach will be regarded as an unethical practice. The good of this ethic is using in the healthcare is the policy in place become more easier for manager in the healthy field to arrive and make better informed decisions. Next, for the virtual ethic. So virtual ethic can also be applied in the public healthy issues because it has elements like honesty, integrity, fairness, and self-control. They are very important in healthy system. As an distinctive approach to medical ethic, virtual ethic investigate how doctor goods moral character enable them to promote the good for the patients. This is very important to public health system in order to balance respect for individual freedom and liberty in our society. It also can build a trust between the public healthy professionals and the people. That's all for me, and the other two will continue with my friends. Thank you.
Okay, for the third application is the right ethics. So the right ethics is established by a society are protected and given the higher priority. So rights are considered to be ethically correct and valid since a large population endorses them. So individuals may also base on right above others if they have the ability and resources to do so. So the right ethical is there are some right, both positive and negative, that all humans have based only on the fact that they are human. This right can be natural and conventional. There is natural right are those that are moral, while conventional are those created by human and reflect society value. Lastly, the duty ethic can be applied in the public healthy issue because it is a teaching that some is right or wrong because of the sort of thing they are, and people have a duty to act accordingly regardless of the good or bad consequence that may be produced. So some kinds of action are wrong or right is themselves, regardless of the consequence. For example, duty of doctor are listen to and respond to their concern and preferences. So give a patient the information they want or need in a way they can understand. Respect patient right to reach decision with you about their treatment and care. support patients in caring for themselves to improve and maintain their health.
For the lastly, in a conclusion, this Marburg disease is very dangerous and can be spreaded. Then, this Marburg disease has no specific treatment or any vaccine. Okay, then to avoid this Marburg disease, we need to keep our hygiene and our environment. Furthermore, we need to wash our hand, wearing mask, avoid that place at high risk, and sanitize our hand. That's all. Thank you.